What if I told you that one of the most misunderstood topics in men's health after 60 is something most men have been doing their entire lives, but were never properly educated about? And what if I told you that many older men come into my office quietly asking the same question: Doctor, is masturbation still safe for me at my age? Or even more concerning, did I hurt myself by stopping? Today, we're going to talk openly, honestly, and medically about masturbation in older men, what science really says, what most men wish they knew sooner, and how it affects your prostate, your erections, your hormones, your heart, and even your lifespan. Stay with me, because this may change the way you think about your body forever. Hello, I'm Dr. Jessica Williams. I'm a board-certified urologist, and I've spent years treating men in their 50s, 60s, 70s, and even 80s. I specialize in prostate health, erectile function, hormone balance, and male aging. And let me tell you something very important. Sexual health does not expire with age. But unfortunately, misinformation, shame, and silence often increase with age. So today we're going to clear the air. This is a judgment-free, science-based conversation about masturbation in older men, the benefits, the myths, the risks, and what most men wish they had understood decades earlier. Section 1, the big problem, why older men stop talking about it. Let's start with the core issue. Many older men were raised in generations where masturbation was labeled as dirty, weak, harmful, or something only young men did by the time they reached 60 or 70, many men either. Feel embarrassed about it, think it's unsafe for their heart, believe it damages the prostate, or assume they're too old to have sexual urges. But here's the truth. Your body does not suddenly stop being sexual just because you retired. Testosterone declines gradually, yes. Erections may change, sensitivity may shift, but sexual function remains part of healthy aging. And masturbation, when done safely and reasonably, can actually support that health. Section 2, is masturbation safe for elderly men? Let's address the biggest fear first. Can masturbation cause a heart attack at my age? For most healthy men, no. Masturbation is generally equivalent to mild to moderate physical activity. In fact, climbing 2 flights of stairs typically places more strain on the heart than masturbation does. If you can walk briskly without chest pain, severe shortness of breath, or dizziness, you can usually engage in sexual activity safely. However, and this is important, if you have unstable heart disease, recent heart attack, severe uncontrolled blood pressure, advanced heart failure, then you should speak to your cardiologist or urologist first. But for the majority of older men I see in clinic, masturbation is not dangerous. In fact, in some cases, it's protective. Section 3, the prostate connection, what most men wish they knew. Now let's talk about something extremely important, your prostate. Research has shown that regular ejaculation through sex or masturbation may reduce the risk of prostate congestion and potentially lower prostate cancer risk. One large study found that men who ejaculated more frequently throughout adulthood had a lower risk of developing prostate cancer. Why? Because ejaculation helps clear prostatic fluid. Think of it like maintenance for the system. When older men stop ejaculating completely for long periods, some report pelvic discomfort, pressure sensation, increased prostate congestion, even urinary irritation. Now, this doesn't mean you need to follow a strict number per week, but it does mean this. Ejaculation is not harmful to the prostate. In many cases, it's part of healthy function. Section 4, erectile function, use it or lose it. This is something older men tell me all the time. Doctor, my erections aren't as strong as they used to be. And I ask them, how often are you getting erections? Here's what many men don't realize. Erectile tissue requires oxygen-rich blood flow to stay healthy. Spontaneous erections, including during sleep, help maintain tissue elasticity. But if erections become infrequent for long periods, the penile tissue can gradually lose flexibility. This is sometimes called disuse atrophy. Masturbation can actually help maintain erectile function by promoting blood flow, supporting tissue health, keeping nerve pathways active. It's not about performance, it's about circulation. Think of it like physical therapy for your vascular system. Section 5, hormones and mood. Another secret older men wish they knew: sexual stimulation doesn't just affect the genitals, it affects the brain. During orgasm, your body releases dopamine, oxytocin, endorphins, prolactin. These chemicals can improve mood, reduce stress, support sleep, decrease anxiety. Many older men experience loneliness, retirement-related identity shifts, or mild depression. Healthy sexual expression, including masturbation, can support emotional balance. It's not just physical, it's neurological. Section 6, the guilt factor. Now let's talk about something very real: guilt. Many men in their 60s and 70s were taught that masturbation was morally wrong or harmful, and that internalized belief can create shame, even when no medical issue exists. Here's my professional opinion. If something is safe, private, not compulsive, and not interfering with your relationships or daily life, it is not a medical problem. Healthy sexuality is part of human biology. Age does not cancel biology. Section 7. When it can become a problem now, I want to be responsible and balanced. Masturbation becomes concerning if it's causing physical injury, excessive friction, pain, bleeding. It replaces meaningful relationships completely. It becomes compulsive and uncontrollable. It's linked to excessive pornography that causes erectile dysfunction. Some older men develop pornography-induced erectile dysfunction because the brain becomes conditioned to high-intensity stimulation that real-life intimacy cannot replicate. If you notice, difficulty maintaining erections with a partner, but not alone, needing increasingly extreme stimulation, loss of interest in real intimacy, that's when we need to address the brain component. And yes, that is treatable. Section 8, frequency. How much is normal? This is the question everyone asks. What's the right number? There is no medically required number. For older men, frequency varies widely. Some once a week, some once a month, some several times a week. The key indicators of healthy frequency are no pain, no exhaustion, no interference with daily function, no emotional distress. Your body will tell you what feels right. There is no expiration date and no quota. Section 9, practical tips for older men. Let's get practical. As men age, skin becomes thinner, lubrication becomes more important, erections may be slower. Here's what I recommend. Use water-based lubricant to prevent skin injury. Take your time. Arousal may take longer. Avoid aggressive techniques that can damage tissue. Stay hydrated. Manage cardiovascular health. Erections depend on blood flow. Remember, your penis is a vascular organ. Protect your heart. Protect your erections. Section 10. For widowers and single older men. This is especially important. Many older men who lose a spouse feel confused about whether it's appropriate to continue sexual expression. Let me say this clearly. Grief does not erase sexuality. Loneliness does not require suppression. Self-pleasure in private is not betrayal. It is biological. You are allowed to maintain connection with your body. Section 11. The bigger picture. Aging powerfully. Sexual health is often the first sign of overall vascular health. If erections are declining significantly, it may be early cardiovascular disease, diabetes, hormonal imbalance, medication side effects. So don't ignore changes. Use them as information. Your body is talking to you. Listen to it. If this conversation is helping you, or if you appreciate having medically honest discussions about men's health, please take a moment to like this video. It helps more men find reliable, science-based information instead of myths. And subscribe to the channel. I post weekly videos on prostate health, erectile function, testosterone, aging, and real solutions. If you feel comfortable, comment below with your age and what topics you'd like me to cover next. I read them. Let me leave you with this. Aging is not decline. It is adaptation. Your sexuality does not disappear at 60. It evolves. Masturbation, when done safely and responsibly, is not dangerous for most older men. It can support prostate health, it can support erectile tissue, it can support mood and sleep, and perhaps most importantly, it can remind you that you are still alive, still responsive, still connected to your body. There is no shame in biology. There is only knowledge or lack of it. Now you have the knowledge. Take care of your heart, take care of your prostate, take care of your mind, and yes, take care of your sexual health. I'm Dr. Jessica Williams, and I'll see you in the next video.